Hello, I'm Dr. Shreeja Karan. I'm a gynaecologist, obstetrician, and a fertility expert practicing in Rainbow Hospital, Sarjapura Road. Today in this video, I'm going to address a very commonly asked question: what is IVF? When should it be done? And what all does it involve? So IVF, or what we understand as test tube baby, is basically an advanced fertility treatment which is offered to couples who have been unable to conceive after 1 year of trying, and they've been diagnosed as a condition with condition like severe male factor infertility, or something called as endometriosis, bilateral fallopian tube blocked, or advanced maternal age, or some women who have diminished ovarian reserve. It is also a treatment which is offered to couples who do not have any major factor, and this condition is called as unexplained infertility. And sometimes when other treatments fail, this could be another option. So coming to IVF, it basically involves giving injections to the lady to stimulate her ovaries and produce more and more eggs. So it involves two phases. First phase being the ovarian stimulation, wherein the lady receives injections for around 10 to 12 days, depending on various factors like her age, her egg reserve, etc. And then once she is ready, once we feel that her ovaries have produced enough eggs and they're all mature, then she undergoes a procedure called as ovum pickup, or it's called oocyte retrieval, which is done through transvaginal scans. And this procedure is basically a daycare procedure wherein the eggs are removed from the ovaries using a fine needle, and then with the partner's sperms, these eggs are fertilized. After fertilization, the embryos are grown in the lab in optimal conditions for around 3 to 5 days, and then ultimately we know how many embryos and what quality of embryos we have in our hands. And after this, the embryo transfer procedure is done, which is the second phase. So it can happen in the same cycle, or it can happen in the subsequent cycle, again depending on the woman's response. So in the embryo transfer cycle, the lining of the uterus is prepared using some tablets or sometimes injections. And then when the endometrium or the uterine lining is ready, then we do the process of embryo transfer. So in this, the embryo is transferred using a very fine catheter inside the uterus, and this is done under scan guidance. So once the procedure is done, then we wait for the pregnancy test to be done after 12 to 14 days, and then the blood test is done. So the entire process involves a span of 2 to 3 weeks, and the success rate happens to be around 30 to 50%, which again depends on the age of the partner, both the partners, and the egg reserve and the quality of the eggs and the sperms. So this is all about IVF, and thank you.